In this video, we will discuss about this in vivo results of their lipo-NC-pGSDMB platform that they have developed. So here, what they did is they inject the T4-1 cells in the pre-drilled hole in the bone marrow of the mouse, and after this 7 days, they treated them with different kind of treatment methods, including their lipo-NC-pGSDMB. And what they are able to see is that after 28 days, in their optimized method, they are able to see around complete suppressions in most of the cases, whereas in other case, the complete suppressions is not there. And these things they have then quantified in the panel C, where we can see that the tumor suppressions is maximum in the case of their lipo-NC-pGSDMB conditions. And when they check this tumor reductions, they can see that tumor reductions are also high for their in vivo system compared to the control and the control and the conditions which does not have pGSDMB. And later on, the tumor weights are also quantified in the panel E, where we can see that tumor weights are also low, as this is what we have expected. In terms of the survival rate for this lipo-NC-pGSDMB shows 100% survival rate, whereas this empty vector lipo-NC with empty vector shows 60% survival rate, and the control shows 20% survival rate. And thereafter, they wanted to check the impact of their treatment will prevent the bone density, or prevent the impact of this bone cancer on the bone density or not. And here we can see that the bone density impact, bone density and other parameters that affect the bone integrities does not get impacted in the case of this lipo-NC-pGSDMB compared to the all other cases. And these things they have quantified in the panel H, I, J, K also, where H represents this bone volume fractions, which also increased in their in vivo system. And similarly, for this bone mass density also increased, and trabecular numbers and trabecular numbers increased, but trabecular separations decrease, which is also what the researchers expected, as the trabecular separations goes down and the trabecular number increase, and the bone mass density and bone volume fractions needs to be increased, which is a good indication of the bone health. And once they validated that the system will be able to prevent the bone health also, then they wanted to check about the osteoclast, whether osteoclast is one of the major cause of the bone cancers. So when they check it for the osteoclast using the trap signalings, they can see that osteoclast is minimum or reduced in the case of their optimized system. And these things they have quantified in the panel M and N, where M represents the osteoclast surface and N represent the osteoclast numbers. Both of them goes down. Then they further quantified it using qPCRs of the genes that helps in this osteoclast differentiations. And we can see that osteoclast differentiated genes goes down in their optimized condition cases compared to the control case. And also to some extent there is a osteoclast differentiation in the lipo-NC without pGSDMB or with empty vectors. So here we can see that it will also prevent the osteoclast differentiations in the bone cells, their delivery system. Thereafter, they want to check the impact of this axon infiltrations, and in that case they use the DIL dye in the axons, and they can check whether these axons will be able to infiltrate in the tumors. And they checked it at 3 different places, it is inner side, middle side and outer side of the tumors. And they can see that from the fluorescence image, we can see that the their lipo-NC-pGSD system is able to reduce the axon infiltrations in all the three cases compared to the control and lipo-NC without pGSDMB. And these things they have quantified also, where we can see that the percentage of the DIL signals is low in the lower, middle and inner part of the tumors for the case of their lipo-NC-pGSD system. Thereafter, the final test they did using the physical test, which is the Catwalk gait analysis, and here the vehicle results are similar to the results of the conditions in which they use lipo-NC-pGSDMB. And these things they have quantified also in terms of the intensity, time and withdrawal threshold. And these things, let's say intensities, times and withdrawal threshold, in out of the three conditions that they have tested, the conditions in which they use lipo-NC-pGSDMB is more closely aligned with the vehicle. So this all, and lightweightness also aligns with the vehicle. So this all results indicates that the lipo-NC-pGSD system not just able to suppress the immune response, but it can also help in maintaining the bone integrities and prevent the osteoclast differentiations, and axon infiltrations are also prevented in the tumors. And finally, the physical performance is also similar to the vehicle. You can also maintain the similar physical performance. So this is what they have finally concluded after the results that are presented in this figure. If you need to understand more about these experiments in detail, you can go through the reference that has been provided in the description. So that's all for this video. Thank you for your time.